diagnostic test and procedure for diagnosis of prostate carcinoma. Clinical assessment is decided from the history of the patient. The patient gives history of dysuria, hematuria, and incontinence of micturition. Then we have to proceed to exclude the other pathologies of the prostate before proceeding to the treatment of the carcinoma. That is, mainly we have to exclude the chance of benign prostatic hyperplasia, which is an innocent inflammation of the gland. For that, we perform the test which is called as digital rectal examination. In this process, doctor passes gloved and lubricated with local anesthetic cream into the rectum and palpate the prostate, its location, its size, circumference, texture, consistency. They are estimated and concluded by the surgeon during this examination, simple examination. And then next is the most specific test of the laboratory, that is called as prostate specific antigen test of the blood. Blood is collected and sent to the laboratory for estimation of the level of this antigen in the blood. Normally the level of the antigen is near 1 nanogram per ml, milliliter. If it is exceeding, it is going towards 5 gram or even above that one, so there is more chances of carcinoma of the prostate. But even then we have to do final diagnosis before starting the treatment of the cancer. For that we perform the specific test, that is the prostate biopsy test. For that we perform transrectal collection of the biopsy, the tissue of the prostate from the different parts of the gland through the transrectal route under local anesthesia. So we pass the instrument along with the needle in the rectum, and through the rectum we collect through the syringe we collect the tissue of the prostate, and then we submit that to the laboratory for pathological study under the microscope. There it is differentiated whether it is a benign tumor, whether it is a malignant tumor. If it is malignant, then its histological study, that is whether it is adenocarcinoma, squamous carcinoma or transitional carcinoma. Mostly 95% prostatic carcinoma belong to the adenocarcinoma. So these are the basic three: laboratory and the the clinical test to decide the treatment, whether we have to start treatment for carcinoma or for benign tumor. Because this prostate is mainly affect the bones of the patient. When it enters in the final stage, that is 4th degree or 4th stage, then it is a very injurious, very critical stage, metastatic stage. The metastatic is the part or the pieces of the cancer cell that passes through the bloodstream and the lymphatic channel to the distant organ, especially in the bones of the various area. Pelvic area, which are close to that prostate. Then it is hip bones. Then there are especially the vertebral spines, and the spinal cord rib space. So they produce bone pain. So for that we also adopt the traditional or conservative treatment for the pain pathology, that is ancient medicine and drugs in the form of the oral pills or the shots to relieve the patient from the distress of the pain. Then it is a very critical one that the bones become very weak due to these metastases and they suffer frequent bony fractures. Even the light pressure to the bones or the simple fall there can create the fracture of the bone. Moreover, there is sexual disturbances, especially the erectile dysfunctions, ejaculatory obstruction, infertility, then neurological complications, that is, there is depression, anxiety, these are the various complications. Moreover, this prostate carcinoma that spread into the urinary bladder, into the rectum, and moreover other distant organs like liver and the lungs also. These are called the secondary prostatic carcinoma that produces the signs and symptoms of the related organs where it is implanted or where it is seated. So prostate is a second largest carcinoma which occurring in the human beings, male factors. So next to the carcinoma of the lung. There is obviously age limit, mostly it is above 50 years age.